Lung cancer, the most common cause of cancer death in the United States and around the world, also known as carcinoma of the lung or pulmonary carcinoma, is a malignant lung tumor characterized by uncontrolled cell growth in tissue of the lung. It starts in the lungs and happens when cells in the lung mutate or change. When a person has lung cancer, they have abnormal cells that cluster together to form a tumor. Tumors are dangerous because they take oxygen, nutrients, and space from healthy cells, and they invade and destroy or reduce the ability of normal tissues to function. If left untreated, this growth can spread beyond the lungs by process of metastasis into nearby tissue or other parts of the body. The major cause of cancer death in men and women is lung cancer. This situation is relatively new and is mainly due to cigarette smoking. In 1876, a machine was invented to make rolled-up cigarettes and thus provided cheap tobacco products to almost everyone. At that time, lung cancer was relatively rare. Smoking dramatically increased, and so did lung cancer following this innovation. Currently, about 90% of all lung cancers are related to smoking. Random gas, pollution, toxins, and other factors contribute to the remaining 10%. Cigarette smoke contains over 70 cancer-causing chemicals or carcinogens. In addition, cigarette smoke damages and can kill hair-like projections on airway cells, termed cilia. The cilia normally sweeps out toxins, carcinogens, viruses, and bacteria. When the cilia are damaged or destroyed by smoke, all of these items may accumulate in the lungs and may cause problems such as infections or lung cancer. Although smoking results in the highest risk of causing lung cancers, other environmental exposures to certain compounds and chemicals increase the risk of lung cancer. Such agents as asbestos, radon, rhenium, arsenic, benzene, and many others increase the risk for developing lung cancer. Also, many cleaning supplies or household products, such as that include ammonia and bleach, contribute to chronic respiratory problems, allergy reactions, and as a result, a possible lung cancer cause. Tobacco smokers put others at risk of developing lung cancer. A non-smoker, a wife or a child who lives with a smoker, has a 20 to 30% chance increase in risk of developing lung cancer. Unfortunately, lung cancer often have either no early symptoms or non-specific early symptoms that people often dismiss. Early non-specific symptoms may include one or more of the following: cough, chronic or recurrent, fatigue, weight loss, short of breath, or wheezing, coughing or phlegm that contains blood, or chest pains. A screening for lung cancer is usually done by 3 methods: a physical exam, a patient's history of smoking, and a chest x-ray. A sputum cytology exam, cells examined by a pathologist, or a spiral CT exam. Lung cancer diagnosis. If this screening test suggests a person has lung cancer, definitive diagnosis tests may be done by a pathologist. The pathologist will examine the patient's lungs, cells in sputum, blood, or from a biopsy sample to type and stage the cancer. There are only 2 major types of lung cancers: small cells and non-small cell lung cancers. Non-small cell lung cancers account for 90% of all lung cancers and are less aggressive, which means they spread to other tissues and organs slowly than small cell cancers. After the type of lung cancer is determined, and the type is then assigned a stage. This stage indicates how much the cancer has spread in the body, for example, to the lymph nodes or to the distant organs like the brain. Stages for non-small cell cancers are different from small cell cancers. The following 2 stages are used for small cell lung cancer, which are limited stage, extensive stage, small cell cancer. And the following stages are used for non-small cell lung cancer, which are occult end stage, stage 0, which is carcinoma in stage 2, stage 1, stage 2, stage 3A, and stage 3B, as well as stage 4. Early stage, which is stage 0 or even some stage 1, cancers, treatments of non-small cell cancer may benefit from surgery. Part of all of a lung segment that contains the cancer may be removed in some individuals. This may result in a cure. However, many patients still undergo chemotherapy, radiation therapy, or both to kill any cancer cells not removed by surgery. Because small cell lung cancers are almost never diagnosed early, surgery and other treatments may prolong life but rarely, if ever, result in a cure. Most small cells and non-small cell cancers are treated with chemotherapy. They may also be treated with radiation therapy and surgery. In many patients with advanced disease, these methods may be used together, depending on the patient's condition and recommendation by the cancer doctor. New therapeutic treatments are being tried. For example, some therapies termed target therapies are designed to prevent or stop lung cancer cells from growing by targeting the new blood vessels that are needed to allow the cancer to survive and grow. Other treatments target growth and multiplication of lung cancer cells by interfering with chemical cancer cells, which is illustrated in this slide above. After a diagnosis of lung cancer, it is not unusual to feel depressed and upset. However, research is ongoing and it is impossible to survive and extend your life with treatments. Even with the diagnosis, there is evidence that people who develop a healthy lifestyle and stop smoking do better than those who do not change. For the majority of lung cancers, prevention is possible if a person never smokes and avoids secondhand smoking. For smokers who quit within 10 years, the risk of getting lung cancer drops to about the same risk as they had never smoked. Avoiding other risk factors may also prevent some people from developing lung cancer. Unlike normal cells, cancer cells grow without order or control and destroy the healthy tissues around them. Most lung tumors are malignant and they can metastasize or spread throughout a person's body to the bloodstreams or lymphatic systems. Cancer metastasis is the spread of cancer cells to tissue and organs beyond where the tumor. Lung cancer is very life-threatening because it has a tendency to metastasize early in its course. Liver, brain, and adrenal glands are more commonly affected. It also affects person's lungs and any parts of the respiratory system. When the lungs have difficulty doing their job, other organs in the body have difficulty doing their jobs. The health of the lungs has direct and immediate effect on the overall health of the body.